now I would invite Dr. Mark Miller to the podium to introduce Dr. Anthony Greco.
Well, you've seen Dr. Greco here. He just answered a question, and I've been practicing medicine here since 1970. That's 39 years. But as of this last year, my main claim to fame has not been that, but the fact that my wife is the Tea Party organizer. And actually, I've been thinking about that this afternoon, and I think maybe a better term, considering the words that are going around, would be Tea Party czar. Well, Dr. Greco and his wife Anna live in Mount Pleasant, just down the road, and they have 3 children. He practices dermatology. He's a skin specialist there. And I began to get acquainted with him about 2 or 3 years ago when I began to refer him patients who had skin problems. And my patients reported to me that they liked the way he related to them. They also liked the way he managed their skin problems, and so I feel really comfortable sending patients to him because I believe he's a very excellent dermatologist. Dr. Greco received his medical training in Canada. He went to medical school in University of Toronto, and he had an internship there. Then he got his dermatology residency and training in Montreal. And I had his credentials, and he has excellent medical credentials, which include a couple of scholarships and rewards and research projects and journal publications. In fact, one of the journal publications that you'd probably be interested in was the effect of estrogen on the metabolism of high-density lipoprotein in the rat liver cell. And he'll be glad to speak with any of you about that after the meeting. Well, his medical credentials are not the reason that we ask him to come. The reason we ask him to speak to us is because he's uniquely qualified to compare government-run health care with the kind of health care that we have in the United States, or we have known, because he was born and raised in Canada, and I believe it's right that he saw government-run health care be accepted in Canada. So that helps, and we probably hear something about that. And of course, he was trained under that system, and he has had first-hand experience receiving health care under that system, and also delivering health care under that system. And his parents and his relatives still live in Canada, so he's assisting them in making the right choices as far as their health care goes. And now for 15 years he's practiced medicine in Texas, so he is well familiar with our health care system. And by the way, he does speak French, and he is willing to give this presentation in French. If everyone who wants to hear it in French, Anthony, come on up. You're going to have to give it in English.
Thank you for the introduction, and I thought I might give the lipoprotein rat lecture in French. That would probably be the better way to do that. But I was going to start off by saying the words that we all love to hear. I'm from the government, and I'm here to help you. David Bauckham spoke of cash for clunkers, and when I heard this week about what's going on for cash for clunkers, I said, that's all I need to say in my talk, because That, to me, crystallizes the Canadian healthcare system to me. If you're an auto dealer, you understand what the physicians go through in Canada, because most of the auto dealers have not received any checks at all for all of the clunkers that they took in. In Canada, it's very much the same as a doctor. You wait and you wait and you wait for your reimbursements, and sometimes you're fortunate to get a percentage of them every month, and a lot of times you're not, and you have to keep resubmitting the claims and resubmitting the claims. It's a real bureaucratic nightmare, and I know the auto dealers in particular will understand Canadian healthcare just by cash for clunkers, so that is a real important thing to look at. I mean, the other programs that we've spoken about here already tonight, you know, things like FEMA and the DMV and Medicare, Medicaid, Social Security, and the VA, which was brought up earlier. The gentleman who spoke about the 9-month wait, that's a good wait in Canada. Some waiting periods are 12 to 18 months, so 9 months is actually not too bad. But that's kind of the standard waiting time in Canada for various procedures. Let me tell a little bit about myself. I was born and raised in a town called Sault Ste. Marie, which is right at the tip of Michigan. The St. Mary's River separates the twin Sault Ste. Marie's. There's a Michigan Sioux and a Canadian Sioux. I was born on the Canadian Sioux side, and I always looked over the bridge, and I always said to my mother, why couldn't you have driven over that bridge and had me in Michigan? My life would have been easier. But I used to look across the St. Mary's River, and I used to think, and this was as a teenager, I used to think, wow, Americans are so lucky. They really don't have a lot of government interference in their lives. I used to ask my dad, how much tax do you pay? And he would start, I pay this, I pay this, I pay this, I pay this. So the Canadian tax system, and I'm going to get into this a little bit in a few minutes, but the Canadian tax system is extremely burdensome and cumbersome. And we're heading in that direction. We're not anywhere near that now. When I first came to Texas, I couldn't believe 35% tax. I said, wow, that is amazing. When I was a resident up in Montreal, they took 55% off my check right off the top. And this was as a poor, starving resident. I wasn't making any money up there. And so I'll get into a little bit about the tax system later, but anyhow, I was born in Sault Ste. Marie. I did my medical education, as was mentioned earlier, at the University of Toronto, and did my dermatology at McGill University in Montreal, and came to Texas back in 1995. I was recruited here. I worked for 2 years in a Dallas clinic and then was recruited over to East Texas. And I worked part-time Mount Pleasant and Longview for about 5 years, and eventually established full-time practice in Mount Pleasant. And I've been there full-time now for, I guess, 9 years. I had my first experience in the Canadian healthcare system as a young 13-year-old. I was shooting hoops and went up for a rebound, and my patellar bone or my knee bone pulled out of its socket and smashed in 3 pieces. So I knew there was something wrong. This would be about 7:30 in the morning. Mom took me down to the emergency room. I mean, I couldn't move my leg. It was about this big, size of a balloon. And I sat, and I sat, and I sat. And they had my leg at a 90-degree angle in a wheelchair from 8 in the morning till 8 o'clock at night. I remember opening a washroom door and breaking it even further at one point because they didn't have me on a gurney or a stretcher. I hadn't even been triaged. The orthopedic surgeon came over from his office at 9:30 at night, took some x-rays, told me I had a broken leg, and operated the next morning. But I mean, this is 13 hours after the fact. So that was my first experience. I also was in a room with 4 other patients, 3 of which were Alzheimer's patients. So I didn't get much sleep for the 2 weeks that I was in there. And that's pretty standard. There's no private rooms in Canada as a patient. You're usually in a room with 4 to 8 people separated by a curtain. So it's pretty tough to sleep at night, particularly if 1 or 2 of those 8 folks are having problems. And that was my first exposure to Canadian healthcare as a patient. When I was doing my residencies, I used to examine patients on gurneys in the hallways where people were walking by with cups of coffee watching me work. And this was standard. I used to get called to the emergency room, and we would be seeing heart attack, stroke patients sitting on gurneys out in the lobby where we had to examine them. I mean, there was no other place to examine them because the emergency rooms were all full. And this is downtown metropolitan Toronto. When you get to smaller towns, it's similar situations as well, but in downtown Toronto, that's the norm, and that was the norm as I was working.